Let's talk about that dreaded pop, that awful sound and feeling of an Achilles tendon rupture. It's an injury that can sideline you in a split second, but the choice you make about how to treat it, well, that decision can last for months, sometimes even years. And it's a decision that's been at the center of a huge medical debate for decades. So picture this. You're out playing a sport, you plant your foot to make a move, and then you hear it. Pop. The diagnosis is exactly what you feared, a torn Achilles. And now you're staring down a choice that's going to define your entire next year of recovery. Do you get surgery or not? It sounds like a simple question, but the best answer is way more complicated than you'd think. Okay, so to really get why this is such a debate, we first need to appreciate what this injury actually is. I mean, just how big of a deal is an Achilles rupture anyway? Your Achilles is, no joke, the single strongest tendon in your entire body. It's the powerhouse that lets you run, jump, even just push off to take a step. A rupture is a major, major tear, and it's not just common. It can lead to some really severe disability. That's why figuring out the best way to treat it is so incredibly important. For years and years, the logic felt pretty simple. If you completely snap this super important tendon, you've got to stitch it back together. I mean, it just makes sense, right? But what if that common sense, that gut feeling, isn't actually what the science tells us? And that brings us to the science. In 2022, a really big study dropped in the New England Journal of Medicine that tried to finally put this whole debate to rest. Researchers took a bunch of patients and compared the outcomes across 3 totally different treatment paths. Okay, so this is where it gets really, really interesting. The researchers used something called an ATRS score. Basically, it's just a survey where patients rate how they're feeling and functioning. These numbers here show how much their score dropped from before the injury. So, the bigger the negative number, the worse they're doing. But just look at these scores. Non-operative, open surgery, minimally invasive surgery, they're all practically the same. Yeah, let that sink in for a second. The huge takeaway here is that after a full year of recovery, it just didn't matter which treatment they got. Their ability to function, from their own point of view, was pretty much identical. Surgery didn't give them a better result. And that is the million-dollar question, isn't it? If everybody ends up in roughly the same place after a year, then why are we even arguing about this? Well, it turns out the choice isn't really about the final destination. It's about the journey and the very different risks you have to face along each path. And this gets us right to the heart of the dilemma. You're not just choosing surgery versus no surgery. What you're really choosing is which set of risks you're more comfortable with. So here's the fundamental trade-off. If you decide to go the non-surgical route, your biggest fear is re-rupture, that the tendon just tears all over again. But if you pick surgery, your worries completely shift. Now you're concerned about things like infections or nerve damage from the operation itself. Let's look at the numbers for re-rupture, because this is a big one. Without surgery, there's a 6.2% chance the tendon tears again. With surgery, it plummets to just 0.6%. That means you are literally 10 times more likely to have to go through this whole agonizing recovery process a second time if you skip the operation. Now, a 6% risk is still pretty low overall, but that difference is, wow, it's dramatic. But, and this is a huge but, getting that much lower re-rupture rate doesn't come for free. An operation brings a whole new list of potential problems to the table that you just don't have to think about with the non-surgical approach. Let's take nerve damage, for instance. That big AnyJam study found a 5.2% risk of nerve injury with the minimally invasive surgery. And that's a complication that could leave you with permanent numbness or some weird sensations in your foot for the rest of your life. And that's not it. Other studies point to a whole host of other surgical risks. We're talking about a nearly 6% chance of a superficial infection, problems with the wound healing up, scar tissue causing problems, and even dangerous blood clots, or DVTs. These are all risks that are basically zero if you don't go under the knife. Okay, so you've got a higher risk of re-rupturing on one side and a whole list of potential surgical complications on the other. Where does that leave us? How is anyone supposed to make this choice? Well, the medical consensus these days, like you see in this quote from a big 2021 analysis, is a lot more nuanced. Basically, it says that for the right kind of patient, non-surgical treatment should be the first recommendation. But the key words there are suitable and discretion. This is not a one-size-fits-all answer anymore. So here's the bottom line. Medical science hasn't found a clear winner here. There is no single best treatment for everyone. The science is telling us that the best choice is a deeply personal one. It really boils down to having a serious talk with your doctor and deciding which of those two sets of risks you are more willing to take on. And that brings it all back to you. Now that you know the trade-offs, that the outcomes are pretty much the same, but the risks are totally different, which path would you choose? Would you take the slightly higher chance of re-injury to avoid surgery? Or would you accept the risks of an operation for that peace of mind? It's a fascinating choice, and there's absolutely no easy answer.